Hello my sweeties, welcome back to my channel, and today we're continuing on with the series New Year, Me, You, and I'm here with my friend Claudia, who is the owner and creator of Fab Med Spa. Can you tell us a little bit about yourself?
Yes, so my name is Claudia. I am the owner of Fab Med Spa. I am a family nurse practitioner and I work in both settings. So I do family medicine, and I also own a medical spa.
Can you tell us how Fab was born?
So back when I was a nurse working in the ICU, I was always interested in aesthetics. So it's when the Kardashians were becoming famous. Kylie was getting her lips done, and so I saw an opportunity there for a little extra income. So once I finished school, got my doctorate, got my nurse practitioner, and I finished with that, then I looked into starting something small like this.
And can you tell us what procedures do you offer currently?
So here we offer a whole variety of aesthetics procedures. So our most famous is Botox or Dysport. They're both pretty similar. We also do microneedling, we do sclerotherapy, we do chemical peels, we do vitamin B12 shots. It's just a big variety of services.
Yes. So which ones are your most popular, you would say?
The most popular is Botox. Everybody knows Botox is a well-known brand, and everybody wants to be wrinkle-free. So we all do it. And then microneedling.
Okay. So let's dive in more into Botox. Like, when should one consider Botox?
So what we recommend is Botox to start being a preventative procedure. So don't wait till your wrinkles are set in, because many times it's not late, but now the wrinkle is there, and we have to work on smoothing it and making it less apparent. So we do recommend you start in your mid-20s. And you don't have to go full frozen phase. You can start with it's called a sprinkle of Botox. So just to minimize the movement of the muscle and help with to prevent the wrinkles from actually forming.
And where are they technically done? I know like the smile line, that's one of them.
So that's a big misconception. So the smile line is filler.
Oh, it's a filler. There you go.
So you want to fill that in so that it doesn't look so sunken in. Botox, what it is, it's a chemical that will temporarily paralyze the muscle so it doesn't move. So the most common places is your forehead, the vertical lines on your forehead. The horizontal lines, sorry, on your forehead. The angry lines here, known as like the 11s and nobody likes.
Yeah,
and your crow's feet are the most common. And so that's whenever there's muscle movement and creates a wrinkle, that's where we go. The hollows, like the empty spaces like your cheeks, the smile lines, those are fillers. Or your lips.
Okay, so now as far as Botox, so say one comes in, how often should one continue to come in?
Okay, so Botox is not forever. It does wear off, and it depends on your body and how active you are. The more active you are, you work out every day, the quicker your body will kind of clear it. On average, 3 to 4 months.
3 to 4 months. And what is the price range for this?
So price ranges all the way here. We have a set price of $8.99 per unit. But if you go to other places, it could be anywhere from $8.99 to like $12.99, just depending on where you go.
And when you talk about units, I know for me, I'm like, what? Units what? Can you explain what that really means?
Yeah, so Botox, we inject it as a per unit. Typically on like your forehead, you'll need anywhere from 8 to 12 units.
Oh, okay.
Angry lines, you'll need anywhere from 15 to like 25 units of Botox. And the units of Botox are different from Dysport. So Dysport, usually you require like double the units of Botox. Crow's feet, anywhere from 5 to like 5 per side. 5 would be very, very minimal. But anywhere from 5 to like 12 units you could use there.
So, okay, you said Botox and what's the other one?
Dysport.
Like, how are they different?
So they have the same chemical components. So the only difference is price range and then the dosing, and it also like Dysport kind of kicks in quicker for most people. And then Botox, and it's once we inject it, it spreads a little further, so we have to be a little more careful. And then another quick thing is, like if I inject you today, you're not gonna go home and have all the effects of it. It does take about 2 weeks for full effective Botox to be seen. You can start having improvement maybe 3 to 4 days after we inject. Dysport a little quicker than Botox, but it's not an immediate.
Oh, okay. Now, following that question, I did ask my followers from Instagram, and Jamie asked a very interesting question. She asked, does it hurt or does it feel weird?
So a lot of people think it's gonna hurt because obviously there's a needle that's going in my forehead and my face. I've had it, all my patients say it doesn't really hurt. So I mean, you feel a little like sting, I don't know, but it's not painful at all. We don't you don't need pain medication, and it doesn't really hurt that much.
Okay, sounds good. So that covers Botox, and another one that I want to dive into is lip fillers. Lip fillers are really popular right now. Like, who should get them?
So anybody who wants a little extra volume can get them. And right now it's popular with the younger girls because they all want those Kylie lips and Kardashian lips and stuff. So if you feel like you need a little bit of volume, we will. You can inject it. We obviously don't want anything that does not look natural. I will give you my honest opinion, and we do do an assessment before. Yeah, and then we can tell you which filler. Not all fillers are the same. Which filler is better for you.
And how long does it last? Say like I get Botox done today. How long will it last?
So Botox will last, like I say, 3 to 4 months. But fillers will last anywhere from 6 to 12 months, and then there are other fillers that can last 18 months. Like if you get for the lips, if you get filler for your cheeks, that can last up to 2 years.
Oh. Is there an age limit?
Not for the lip filler.
Yes.
Not technically. So you can have it. There is FDA like guidelines, but really people are injecting at any age.
What is the price range, or did we cover that?
Not for fillers. So fillers, like I said, price range can be all the way to $600, $700. Here we offer Juvederm, which is, I think, in my opinion, it's one of the best for the lips. That one is $450, but we often have specials.
Microneedling. What is it? Because some people might not know what microneedling is.
Okay, so microneedling is a bunch of little needles, and I wish I had the little needles so I can show you, and maybe we can show later. Those micro needles, actually, we put them on a pen, we glide it through your face, and it creates a little bit of trauma. And that's the whole point. So we want a little bit of trauma in your face, your neck, wherever you want it, to stimulate collagen formation. And that has all the healing properties, and it is really good for fine wrinkles, for pores, for dark, like that. Dark spots from the sun, from pregnancy, stuff like that. Stretch marks is really good. It helps with so many things, and it's affordable, and that's why I think it's one of our most popular services.
And what is the price range on that one?
So there's 2 types of microneedling. We have the basic one that's just a microneedling with a hyaluronic acid that we glide through your face, and that has really good results. And that one is $175. We often have specials on that as well. And then there's a second one, which you guys know is a vampire facial, where we get your blood, we take your blood out, we spin it, we get the platelet, and that's what we use to inject. So when we inject the platelets and all those properties, you get up to like a 60% improvement on your results. And that one is anywhere from $350 here, depending if we have a special, to $425, which is our normal price.
And on that one, does it hurt? Like, say, like, you know how you say there's 5 points?
Yes.
Does that hurt?
Yeah, so there's anywhere from 11 to 36 needles at a time. It does hurt. So most people say it hurts a little bit, but we do know your face or whatever area you're going to get. You still feel a little bit of pain, but it's not intolerable.
And so the results, do they see them like the following day, or does it take a week, or?
It can take anywhere a week to 2 weeks. We usually, with stuff like this, you won't see all the improvement in one session, so we do recommend at least 3 sessions. Yeah, at least 3 sessions, at least separated, depending on what we're targeting, but at least like a month apart. If we're targeting something deeper like stretch marks or acne scars, then we can do it more frequently.
Okay. But frequently as in every 2 weeks, every month?
Every 2 weeks usually.
Every 2 weeks.
If you have like nice skin and we're just targeting like pore or something that is not that deep, you can get away with just doing maintenance every 3 to 4 months of microneedling.
How long is the session?
So we numb you, usually that will take like 15 to 20 minutes. And then the actual microneedling procedure anywhere from 25 to 40 minutes, just depending what we're targeting.
Did you want to cover any other procedures more in depth?
If like the other most popular procedure that we do is the sclerotherapy. So it's the little, like if you guys have little spider veins, especially in the summers here, everybody wants to wear shorts and stuff like that. So that's another procedure we do. The price is $150 per 30-minute session. So in 30 minutes we target as many spider veins as we can. And that's one of our other most popular.
And that one, is there like not one session is going to tackle it? Do they have to do multiple sessions?
Just depends. If you don't have that many, and we can get them all done in 30 minutes, then you don't need another one. But if you have a lot of spider veins and we just can't get them all done in 30 minutes, they'll need another one.
Okay, sounds good. So what is your name?
Claudia.
And what procedure are you getting done today?
I am going to get Dysport, which is Botox.
Okay. And where are you getting it done?
I do it on my forehead, and then she started doing it like around my crow's feet here.
Yeah. Are you excited?
Of course I am.
How long have you been doing this?
I've been getting Dysport probably for like 2 or 3 years now, I would say.
Okay. And so far you love it?
Oh, I love it. Yeah. Ever since I started getting it, I feel like people notice. What's great about Dysport is that it's so subtle, but it's so effective. What I love the most is that it just kind of lifts my forehead like this, and it just makes my eyebrows. I love the arch that it creates.
Yeah. Right.
Which really opens up the eyes.
Yes. So we're gonna go ahead and do a behind the scenes on how she gets her procedure done.
So you still have a little bit of movement, right? So
I do, yeah. Mostly up here.
Mhm.
And I don't know if you remember that this eyebrow always wants to go higher than this one. So I feel like this needs to go up a little bit.
So then we'll have to inject a little bit here for the eyebrow lift. So she's here for her follow-up. She had Dysport about 2 weeks ago, so she doesn't need to be treated fully. We just are gonna add, and usually for most of my patients, I do recommend a 2-week follow-up, and that's where we add more Dysport or Botox wherever it is needed. So for her, so you can still see a little bit of movement up here, so we'll probably do a few units there. And then she has an uneven eyebrow, so this eyebrow tends to go up higher. So if you can see, it's a little bit higher. So we'll put a little bit of Dysport here to just kind of do that eyebrow lift. How about your curls?
I honestly I haven't really looked too closely, so.
Can you turn this way a little bit? Smile. Okay, those I think are good. So let me take my pictures, and then we can clean you up and so wrinkle up. Not bad. You won't need a lot.
No, it looks, whatever you did here was great because you can't even see any of the
Go
lines.
ahead and frown.
I did. That's
You
what I
see
was
she's trying to make those 11s.
And I normally have
She can't.
11s.
And then she's wrinkle up. There's no vertical or horizontal lines. And then smile big. Cheesy smile.
Cheesy smile, yes.
Yeah.
This is not how I normally smile.
I'm trying, and she has no crow's feet. Sorry. Cheesy smile. Alright, so you won't need a lot.
Okay.
And does this hurt for
You know, it doesn't really hurt. You know, and it's obviously a needle in your forehead, but I wouldn't say that it's painful. Once the needle is out, you don't even feel anything.
Are there any side effects that you've experienced?
Not really, no.
So one of the most common, like usually, would be a little bit of bruising, especially in this area, but that's really rare as well.
Never had bruising.
Some people can have a little bit of a headache. That's also rare, but it can happen. Other than that, unless it goes into the wrong muscle, there's not much of a side effect, unless you're allergic or something. So what we're gonna do is clean her and then mark where we're gonna go.
It's funny because ever since I started getting Dysport, people always ask me if I get my eyebrows microbladed.
I was gonna ask you that.
No, this is all natural. My Middle Eastern eyebrows.
Just turn this way and then wrinkle up. So and then wrinkle up again. You don't have much movement here, and I think that's why you still have movement here. And remember that top muscle kind of lowers, so that's why this is a little bit higher. And I'm just gonna put like just a little bit here to give you that lift. Okay. You know what? Let's just wait and see how this, once we treat this, because it will lower. We don't want to
This
lower
side will
and
lower?
then lift.
Okay.
And then if in a week you still need it, then just come in.
Okay.
Just give you that. It's just better. So you're only gonna use like 4 units.
Really?
Yeah. Because you're okay here, you're okay with the
Mhm.
curls. Well, I will give you another 4 right there. So 8 units, so not much.
Okay.
And then wrinkle up.
See that? I didn't even feel at all.
You're done. Just usually it's that quick. So maybe in a week, just if you notice that it's still higher, just text me and I'll get you.
Okay.
Can you tell us what are your current specials for the month?
So every month we have different specials, but this month I have the microneedling with PRP at $350, and PRP is a plain, so it's not a vampire facial. I have the chemical peel. Oh, I forgot to mention that. That's a really popular one too. Chemical peel. We have it for $150. It can range anywhere from $150 to $200 depending on which one you want. I have. What else do I have?
I saw one earlier today, I think. Something about Kylie.
Oh, the
This Kylie
Kylie
special.
Yes. So it's a package that includes the lip filler. So it would be Juvederm. It includes an eyebrow lift, and that we do with Botox.
Okay.
And it includes a lip flip. So lip flip, we inject a certain amount of units of Botox here. It kind of relaxes this muscle and flips up your lip to give you like a heart shape type of lip and the illusion of more volume. So it has all those 3 things in there for $575 a week.
And up to when is this all these specials good for?
Up to the end of January.
The end of
And
January.
then February I'll post new specials.
So if anybody's interested in these procedures, where can we find your med spa?
So we are located inside Blush Boutiques. It's at 2929 East Camelback Road in Phoenix. It's inside Suite 140.
Alright, so if you are interested in any of these procedures, you know where to find her, and I will link all her information below and all her social medias. And if you have any questions, what is your email address?
The email you can send us a message is dashofabmedspa@gmail.com.
Alright, so we hope this has been all informative for you. And again, if you have any questions, just comment below, or you can go ahead and follow Fab Med Spa on Instagram, and I will go ahead and put it on the screen as well as in the description box. And we hope you liked it, and hope you share, like, and subscribe, and hit that notification bell for future videos. And until next time, bye.